We have described it as much as we can. The case of cancer. This is cancer. It's just as bad as it could be. Of course, why not? So let's grab another CT scan of the abdomen. Hope it's not cancer, because it's just really tiring. I'm just get fed up with cancer patients really quickly these days. I've gone through this way too many times. I don't have that patient I used to have back when I was just a young doctor going through endless piles of CT scans. Just wait up. Yep, it's here. This is contrast enhanced. Hope there is a reason for this. This is a 45-years-old female patient. It says she has acute and strong pelvic pain and might be some kind of pelvic cyst on the right and ascites. So I don't know. Let's see what we can tell. I have a template for this, of course. Right there, template is set. Let's scroll down. Liver seems fine. There is a moderate ascites indeed. It's looks like fluid. Contrast timing is wrong, but it isn't the end of the world. Just wrong, as most of times it is. There is some kind of cystic lesion right there on the mediastinum, which I'm going to ignore because this is a abdominal CT scan, not a chest CT scan. So settle down, not going to report it. If they want a chest diagnosis, they can always order a chest scan. Oh, this is something. I have no idea what this is. This is some bizarre cystic lesion right where it was supposed to be the right parametrium. Usually this is related to some sort of reminiscent, some sort of Adnexal mass, some sort of fallopian tube or ovary that was left behind when they took out this patient's uterus. So there is no uterus, this is just fluid, and there is this odd looking partially cystic lesion right there. I say it's partially cystic because it clearly has fluid attenuation 25, and it only enhances on the walls. So there is enhancement right there. See, no enhancement here. There is, see, from 38 to 51. So these are either a solid component or a thick wall, which makes this lesion a very good candidate for a exploratory laparotomy. So there is also thickening of the bladder walls and diffuse edema of the fat tissue inside the pelvic cavity. So this is an acute setting of some sort, probably a torsion or a infection some sort of inflammatory response to this thing right there. Liver is fine, spleen is fine, there is moderate ascites, moderate, diffuse edema of the intracavitary fat of the pelvis, and that huge lesion right there, which is 9.8 by 5.7. Just going to grab another measurement on the MPR. So the surgeon will be fine. On this, you can clearly see there is a solid part and a multiloculated thick-walled lesion right there. So this is probably of ovarian origin. If I would take a wide guess, probably a tumor of some sort. So let's just report it and get on with our lives, because there are a ton of other scans that just won't report themselves. So just taking this off. Are there enlarged lymph nodes? Yes, some enlarged lymph node right there. Interaortocaval right there. Subcrural, precaval, para-aortic. So there are indeed a bunch of lymph nodes, both on inflammatory settings and in secondary metastatic disease. We are supposed to see such lymph nodes, so it really isn't much, but it is something. So I'm just going to stress that out on the report. Let's see the gallbladder. Always check twice or 3 times for gallbladder disease. No gallbladder disease. There is some inflammatory response on the bladder itself.